Hello, I'm Dr. Nadege Gunn, a hepatologist in Waco, Texas. And today we're going to talk about primary biliary cholangitis, diet and lifestyle changes. And these are just tips that you can use when talking with your patients about lifestyle. Because many of your PBC patients may ask, well, what can I eat? What can I do? How should I live my life to deal with this disease better? So let's start first with diet. So try to encourage your patients to eat a balanced diet. A Mediterranean diet is always a nice foundational diet where they're eating fruits and vegetables, nuts and seeds, fish and chicken, and cooking with olive oil instead of other processed types of oils. Now, the next thing, and you know this, is that people living with PBC are at risk for bone health issues, right? Osteopenia, osteoporosis. So you want them to support their bones to ensure that they're getting plenty of vitamin D, calcium, doing resistance exercises. And I always like to tell my patients, I know not everybody likes working out. And I'm not asking you to work out, but I am asking you to incorporate resistance training in your lifestyle. So that means push a little bit more, pull a little bit more, add weights to your daily activity. Try to lift heavy things sometimes, as long as it's safe, as long as you're comfortable. Try to build resistance so those bones can be healthy. Remember, PBC, vitamins A, D, E, and K are all supported by the liver and manufactured by the liver. So we want to ensure that there aren't any nutrient deficiencies in these patients. So when the disease progresses, of course, you'll be checking for these deficiencies, but it doesn't hurt to ask your patients living with PBC to supplement with a multivitamin daily, ensure they're getting plenty of those vitamins in their diets. And then if you have to supplement, then you will do that. And then the last thing with diet is avoiding alcohol, right? We know that alcohol can be detrimental, especially in excess. So if we can avoid or encourage our patients to avoid alcohol, especially when they're living with liver disease, that is an important dietary tip. Now, with lifestyle, as I mentioned already, staying active, building in resistance and weight training into the daily routine. If that's a workout, great. But if it's incorporating it into the daily lifestyle habits, whether they're going to the grocery store or going to shop with friends, maybe they add a couple of weights on their wrists or their ankles just to push around a little bit of weight. Encouraging patients not to smoke or involve any of those habits and keeping their weight healthy, because as you know, just because a patient has primary biliary cholangitis doesn't mean they can't develop metabolic dysfunction associated steatotic liver disease. So keeping the weight in balance and avoiding potentially developing other comorbid conditions. Other last thing, especially when it comes to lifestyle, is ensuring your patients get their vaccinations against things that can cause further liver disease like hepatitis B, hepatitis A. So anytime I have a patient living with any liver disease, I always want to make sure they're vaccinated against hepatitis B, hepatitis A, and then avoiding any practices that could lead, of course, to hepatitis C. So just encourage your patients that there are diet and lifestyle tips that can support their journey in living with the liver disease of PBC. Thank you for your attention.